I can bring a little different perspective to this dialogue. I'm a small business owner. I own a law firm with 8 people who work there. And I represent a lot of small businesses in central Maine, and I've seen them struggle to meet their health care premiums. In the past 10 years, health costs in America rose 3 times the rate of inflation, but in Maine, from 2000 to 2007, health care premiums for small businesses rose by 90%. They rose 5.4 times faster than people's earnings. That means that Maine workers actually lost $2,500 of earning power each since the year 2000, and they are now receiving even less insurance protection, although they're paying a lot more for it. I run a small law firm. 1/7 of our revenue goes for health benefits. Every time someone pays a bill of, say, $700 for our services, $100 comes off the top to pay for the health needs of the people that work with me. The federal government collects 2.9% of our wages for Medicare. A large portion of our income taxes goes, what? For Medicaid benefits for very needy people. When economists tell us that 1/6 of the American economy is swallowed up by health care costs, I can see it right in Skowhegan, Maine. Yeah. And what is true for our smallest businesses is true for the very largest as well. See how the mighty have fallen. When a giant like General Motors goes bankrupt, trying to spend $1,525 on health benefits for every car that comes off the assembly line, something is dreadfully broken and wrong here in America. Practically every other civilized nation in America, in the world, can provide health care for all of their citizens by spending about 10% of their gross national product. We spend over 16. We are suffering the equivalent of a 6% sales tax on every single service and product that our economy can produce in America. And sadly, we are not getting much for the dollars that we spend. 46 million Americans are perpetually uninsured. Another 40 million of them are periodically uninsured, and approximately 18,000 Americans are actually dying every year for lack of access to health care. At present rates of growth, America may be spending almost 1/3 of its economy on health care in another 25 years, but we may never get that far if these skyrocketing premiums and crushing deficits turn us into a third-rate nation. What a dismal legacy for our children if we don't act now. Ask yourself, where is all the money going?
We know.
Too much of it is swallowed up by inefficiencies in our insurance system. Still more is spent on highly paid specialists for redundant services. Our hospitals receive their share of the overspending, and our drug companies became the most profitable industries in America even before they were handed the benefits of Medicare Part D. The biggest general problem, ahead of all the others, is our fee-for-service system and the overutilization it produces. We pay more for process rather than results, and mere process is sometimes all that we get. We pay for volume rather than value in healthcare. The political momentum to reform healthcare is stronger now than at any time since the failures of 1994. Labor, consumer groups, and American businesses must come to terms to overhaul this dreadful system. The American health complex is a python around the neck of our economy. There are signs of hope. Old alliances are breaking down. Walmart now supports an employer mandate. The American Medical Association that opposed Medicare in 1965, even the American Medical Association has stepped off the ledge and said that they're ready for reform. When it comes to health costs, we have many common interests at stake. The stars are aligned. And believe me, folks, we cannot afford to fail. Thank you.